Um, you are in a whole new section of the book. All right. Implementation. Okay. We're going to be talking about prevention. Part of this is, okay, we started out with what is a dental hygienist and that type of thing. And we are going to be moving on as we progress through the process of care. But after your initial assessment, and we've gone over assessment in DNH 141, after that's completed, that was the last section. We've assembled all the data. Okay, we've sequenced, we've treatment planned, we've analyzed, okay, and we've come up with a dental hygiene treatment plan and what educational interventions need to be done. Okay, all of that is going to help the patient hopefully acquire optimal health and maintain optimal health. So this is going back to what level of prevention is it? Is it 1, 2, 3, that type of thing? Just it's going to come back and haunt you. Okay, they're already healthy, you want to keep them healthy. If they're not healthy, you want to bring them to health. And if they're not healthy, you want to help maintain them where they are, okay, at optimal health that you can bring that patient to. So everybody's going to be a little bit different. This is called ADPI. And some students were still confused with this in the board review on Saturday, which really perplexed me. They didn't know what ADPI was. This is our process of care. The A starts over here at assessment, okay, assess. We've had assessment already. We've gone over the diagnosis, the assessment data, which we will continue to go over in clinic as we put these things in practice and learn more about the periodontal classification and that type of thing. Now we're going to be doing the planning stage, which is select, prioritize, and sequence the dental hygiene interventions based on what the other two were. Then it's going to be implementation. You always, always, always evaluate the feedback and effectiveness. And this is something that the accreditation team looks at. They want you to be doing self-evaluation. So that's why we have these reflective things. You're going to be doing a clinic journal. What worked and what didn't work? What would you do differently? Okay, and we started a little bit of that process with your talking with your clinic mentors. Okay, what are some of your challenges? What are some of your strengths? And then developing an action plan. Okay, what works, what doesn't work. So that's ADPIE, ADPIE, which is the classic research model. And it always ends in documentation. Now, the question was, what does the D stand for at the end of ADPIE? Well, document, document, document. And they are all interchangeable. So what the board is probably going to be asking you on as far as this type of stuff goes, it will be asking you at what place does this particular service fall into in the ADPIE model? Where does it fall into? By giving you examples. So this again is going to come back and haunt you. And we're starting to talk a little bit more about ethics, okay, and ethical applications, because this is what it's all about. We want you to be competent and ethical professionals, but you're going to be faced with ethical issues and dilemmas every day in private practice, just as you are here in school. You see somebody cheating, or you see somebody that doesn't come in at early enough to get their unit set up, and you're assigned to that student and you're going to want to sit in their chair. I don't think so. It's not ratting out anybody, really. It is just it's holding everybody to the same standards. But there are basic concepts that we're going to need to review. But look at this: understand the patient's perspective. Oh, you are still on slide 2? Okay, hold on. New share. Are you on the dental hygiene process of care?
Yes.
Oh, okay, good. I had two Wilkins textbooks to choose from, and I chose the wrong one. So this is what you missed. Sorry, guys. Welcome back to my class. All right, so ethical applications. We're going to understand from the patient's perspective. Always think about, if you were the patient, what would you want to know? Same thing with when you're as a dental assistant. You know, it's your job as the assistant to explain things to the patient so that they understand what the dentist is doing. You're not just shoving impression material in their mouth. You're explaining them. It's going to be feel kind of sloppy like a pudding. It's going to warm up and then it'll set up. You'll feel it tightening. This has to stay in your mouth for 7 minutes, 10 minutes, whatever. That's all part of what we do, is we educate the patient on why. Same way with radiographs. We're not saying, Mrs. Jones, it's time for your routine bite wings. Saying, Mrs. Jones, Dr. Smith wants me to get an update on your bite wing radiographs to see if there's any changes, blah, blah, blah. Okay, it's that type of thing. We're always taking things from the patient perspective, and you view a concern from various perspectives. Your concern is you need to get this stuff done in a timely manner. Their concern is it going to hurt? How much is it going to cost? Will insurance cover it? Why do I have to have it done in the first place? Okay, those are those various perspectives. Determine who is responsible, document and share objective evidence. Okay, it's got to be objective. Communicate clearly with all parties and act within acceptable moral standards. So those are the ethical implications. So that is what we're doing in this next phase of the book. All right, let's go on to the actual chapter. All right, learning objectives. Again, this is what you should be looking at the end of a module or before a test to see if you can do this. Can you describe? Can you list? Can you explain? If not, then you go look it up. Okay, the steps in a prevention program: you assess the patient's needs, you plan for interventions, and then you implement the plan. And we are going to be there. We, the faculty, will be there in clinic to help guide you through these processes. Right? You are going to perform clinical preventive services that you are legally allowed to do, what is in your scope of practice. You evaluate changes, some good, some bad. Sometimes their bleeding index goes up. Sometimes their pockets deepen. Why do you think that's happening? And then you have short-term and long-term continuing care plans. Short term is, let's try and get this bleeding under control. We'll be bringing you in every 3 months. And once things start getting stable, we can then extend the period of time. But for now, you're in an infectious state, and it's that type of thing. Short term, long term. Short term might be for the patient, well, maybe I'll brush my teeth twice a week instead of never. It's not what we want to hear, but it might be a manageable short-term goal for your patient. And then we are always a counselor. Patient counseling, okay, when to conduct and the setting for preventive counseling. Some offices actually have an OHE room. Now, orthodontists might have that. Perio offices, implants have that. Implant coordinators will have that. where you can go into a separate area, not chair side, and be alone with your patient and work one-on-one with them. But when do you conduct counseling? Sometimes it's right there chair side, and sometimes it has nothing to do with teeth or their oral hygiene. I have had, not many, but I have had times where I never even picked up a scaler or a probe. We just talked because that's what the patient needed to do. And one elderly gentleman who just lost his wife, and he kept his appointment. We talked, I held his hand, we cried together, and I said, let's bring you back. Let's bring you back. You've got other things that you need to contend with right now. Sometimes the employers aren't happy with that, especially if they are a corporate dentist, but luckily mine was a great humanitarian. So we're doing counseling, dietary, nutrition counseling. Sometimes it's off the fly. It's not a separate procedure. You will have a separate procedure, nutritional counseling, when you get into nutrition. All right, but a lot of times during the Canberra, how often do you snack? What do you snack on? Are you drinking fluoridated water? Okay, that's a good time possibly to conduct your counseling after you get all that information together. And our whole thing, our whole goal is to change the patient's behavior. They can know anything, okay? They can know everything. And unless their behavior changes, it's not going to matter at all. So I know that steak and cheese subs with French fries or onion rings are not good for me. But when I go out and I want to treat myself, what do I order? A steak and cheese sub with onion rings. Is that going to help me get my goals for lowering my cholesterol, lowering my blood pressure, making me 5'6" and 120 pounds? No, nothing's going to make me 5'6", but anyway, none of that is. It's just self-destructive behavior. So without a behavior change, true learning hasn't taken place. A true learning hasn't taken place. So health behavior change model, trans theoretical model, and motivation for health behavior change. Review the textbook for these because this is going to all be part of what you need to know. Motivational interviewing. That is a buzzword. Has anybody heard of motivational interviewing before? Everybody's doing it. It's not just yes, no answers. It is, we are partners in this. We will be working together. And I am here to help guide you and be your guide. So that's what I'm here for. I'm not going to make you floss every day, but I can help. And they even have apps for this stuff. Oral-B has apps to remind you to floss. There's apps for smoking. There's apps for brushing. And now the brushes are even telling you how well you've brushed. Oh, speaking of brushes, I have a question. Did you have your Sonicare presentation yet? Do you have a Sonicare toothbrush yet? No.
Yes.
Okay. I'm trying to coordinate that, and I couldn't remember who got what between first year and second year. Because I know you got your Oral-B's because you weren't supposed to, because they didn't have Oral-B's. And with the distribution of the chain of production and everything, I don't know if we're going to be able to get Sonicares for you yet, but I'm trying to work on a time when she can present to you. And that's the hard part at the beginning of a semester, because I don't know when you guys have lecture and when you don't. I know you've got lecture on Friday because I'm there, but I don't know what your Wednesday is. So you'll be getting something for an Oral-B webinar. And she really keeps track too. If you want your toothbrush, you've got to follow her rules for sure. All right, so what is the big thing to see if learning's taken place? It is change in behavior. So motivation for health behavior can involve the MI spirit. Okay, elements of the MI spirit are establishing a partnership, and that is really trying to get a relationship with your patient. And you have to understand where the patient's coming from. We're not judgmental. Okay, we're not giving them our opinion on their lifestyle at all, right? But we're glad that you're here, and I'm here to assist you if you want to. Okay, sometimes we're asking, is it okay that we talk about this? Then there is acceptance, excuse me, and that's what the patient brings. Okay, sometimes we think just because they're sitting in the chair, they want to hear it. They don't sometimes want to hear it. You're always going to get that person that says, just clean my teeth. I don't want to know what's going on. Don't talk to me. But there are 4 patient-centered conditions. Okay, 4 patient-centered conditions. We've got absolute worth, accurate empathy, autonomy support, and affirmation. Right, so know those. That's someplace on chapter 24. So absolute worth, honor the patient's worth and potential as a human being. I see you. I know you're not in a good place right now, and that's okay. We've had patients so embarrassed about the state of their health and their oral health coming in, and it takes a lot for them just to walk through the door. We're glad you're here today. This will be the first day. Let's take it from here. Forget about what's gone on in the past. So we have to respect the patient. And then there's accurate empathy. Okay, now empathy is not necessarily sympathy. Okay, but we need to demonstrate an interest in understanding what that patient's perspective is. Okay, it's the patient's perspective. Did I move slides? It should say motivational interviewing. Oh, okay. And guys, this is one of the reasons, now my perio, just like my oral anatomy slides are going to be a little more comprehensive, but your boards are going to be 99.99% of this textbook. And I am a firm believer in active learning. So I want you to be either going through the textbook and highlighting or writing some notes down, because just reading and memorizing is not going to get you what you need. You hate it. I know you hate it, but you'll thank me. Trust me. I always come back as far as with students going, oh my God, I heard you over my shoulder during the entire exam. Okay, so empathy. And then autonomy support. The patient has the right to choose. They can say yes or they can say no. We can't force anything on them, otherwise it's battery. So when we are explaining things like our treatment plan, it's not only going into cost and this is what we'd like to do and phase 1, phase 2, phase 3, but they always have the right to say no. Right? And that is what we have to respect. And then there's other paperwork for them to fill out if you want to keep them in the practice. You know, sometimes it's, especially if they're sent to a perio office and they're refusing surgery and this and that, they have the right to say no, but they need to understand that the outcome might be further bone loss, further bone destruction, loss of teeth. Okay, they have to understand that when they're declining treatment. And it allows the patients to have independence to choose for themselves what's right for them. And we can't judge them on that. That's hard to do, but we can't judge them on that. And then there is finally affirmation, which instills hope and belief, okay, that the patient can change, right? Let's take baby steps, just like when you're doing OHE. You're not throwing them 12 things for them to do at once. Let's just look at brushing, and let's just look at brushing maybe once a day. And that's a huge step, getting them to brush once a day. You're not going into flossing and proxy brushing and rinsing and doing all this other stuff. Let's just get you doing one thing at a time, and we'll build on that. Okay, so we have, okay, the elements of the MI spirit. All right, we've gone through partnership. Acceptance has that absolute worth, accurate empathy, autonomy support, and affirmation. After that comes compassion. You can't fake compassion. That's a commitment to promoting the welfare and prioritizing the needs of the patient, all right? So yes, I understand that you want white tea. You know, you've got a wedding coming up. But first, what we have to do is we need to, number one, get you out of pain. I promise that we will address the whitening or whatever it is, but this is taking a priority because, okay? And the more we educate the patient, the more we can negotiate with the patient. They want white teeth. Well, let's work on that front tooth first then. Okay, that black front tooth that you don't like. We'll work on that first, and then we'll go to the molar that needs the root canal or something. And you can do things in temporarily as well. So compassion goes a long way with everything in life, doesn't it? Then evocation, and that means that it is a commitment to elicit patients' assessments of their own strengths, thoughts, ideas, and resources. So the patient can provide a lot of information to the clinician. And it's that overall spirit of motivational interviewing that begins with the premise that the patients already have within them much of what they need. They're sitting in your dental chair. So hopefully they want to hear the information and learn. So your task as a clinician is to elicit and draw that motivation for change in behavior from the patient. MI spirit, they are buzzwords, motivational interviewing, buzzwords in business and health. It's been around for a while. So what are some of the guiding principles? It's got 4 guiding principles that assist us, the clinician, in really maintaining a rapport with the patient. And it's, the acronym is RULE, RULE, okay? Resist, writing reflex, understand the patient's motivation, listen to the patient, and empower the patient. RULE. So let's take a look at the R, resist writing reflex. We want the patients to listen to us. We want them to say, yes, you're the expert. I will do whatever you say. It doesn't go like that. That's like when you're going through OHE with the patient. I hear student after student going, now I'm going to show you how to brush. Wrong. Let me see what you're doing. Here's a toothbrush. Can you show me what you're doing? And then you need to try and find something to compliment them on. And sometimes that's hard, especially if they're using the wrong end of the toothbrush. But the resist write reflex focuses on the patient's ideas, their experiences, and their obstacles to overcome whatever it is that you're trying to teach them. Okay, it could be time. I don't have the time for this. I don't have the dexterity. I don't want to put my hands in my mouth. I will not floss. Okay, well, guess what? You don't have to floss. We've got other things for you that can be just as effective or even more effective in your particular situation. Have I got the thing for you? Okay, so we need to fight the urge to correct the patient's problem. All right, that's a reflex of us. And anybody who's a mother knows that, right? That's a reflex of us. What can I do to make it right? I have a 25-year-old, And I need her to communicate with me. Am I a mother or am I a friend right now? I mean, sometimes they just need to vent. And I have to keep my mouth shut, which is really hard for me to do, but I have to keep my mouth shut and just let her talk her way through, just like with patients. You know, I don't know what to do. I don't know if it's worth the $3,000 or whatever it is to get an implant versus just having the tooth extracted. Okay, we can't make those decisions. So we need to try and stay positive for the patient. Okay, we need to try and stay positive for the patient. So that's the R, resist writing reflex. Then we've got the U, understand the patient's motivation. What is their reasons? What would be their reason to want to change? Is their husband complaining or their wife complaining of bad breath? I've had spouses or significant others call me. So-and-so's coming in for an appointment. Their breath smells horrible. Please find out what's going on and correct it. I can't stand it. You know, and you can't say, well, I heard from your wife and blah, blah, blah. So you're asking more detailed questions. Maybe you'll be disclosing them. Maybe what are you doing with your tongue? I'm seeing that your tongue has a lot of coating on it today and it didn't used to. So we have to listen to the patient. We need to use questions to help find out what their motivation is. And we need to be able to help the student voice their own arguments for a behavior change. Yes, I want to be thin and healthy, but I like my steak and cheese subs so much. Well, which do you want more? You want to stay healthy because you want to see this and that and your grandkids and all blah, 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 blah. Or, yeah, me right now, I'm in a steak and cheese frame of mind, but that's just where I'm at. Okay, and then we want to empower the patient. We are there to help the patient, right? Any change in behavior towards the positive, we embrace and we champion. We are the patient's cheerleaders, okay? And the more we can do that and not be judgmental with any slips that go on. Well, I meant to do that. My goal was to start flossing once a week since I saw you last and decrease my plaque index, but my plaque index increased and I haven't even thought about flossing. Well, because something happened in their life and this and that, this and that. That's okay. We'll start fresh. Today's a new day. Okay, so that's empowering. Don't dwell on that. Let's just start today. So in your textbook, you've got on page, what page is it? I think it's 410. There is more of a picture of what the process of MI is, the engaging, focusing, evoking, and planning.
What page was that? I'm sorry.
It looks like this. I don't know what page it's on.
410.
410. Thank you. I don't know. I don't. There it is. I knew I had the slide. I have my cheat notes on the side here, guys. Okay, so what's one of the first things you do, even with taking blood pressure? You're asking the patient's permission. You're not necessarily saying, may I do this, but you're informing them what you're doing and why. Okay, I'd like to take your blood pressure. We do this on all of our patients. It's going to give us a general screening on where, you know, blah, 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 for whatever reason. Same way with the oral cancer exam. We do it on all of our patients. All right, and it's a screening, catching things early. So we're asking permission in order to do things. The same thing with trying to, do you mind if I ask you some questions about your daily habits? You're not just asking them, and how many times do you brush, and how many times do you floss, and blah, blah, blah. Carrie's risk assessment asks that, but I'd like to go through a series of questions to, it's called a Carrie's risk assessment. This will help determine the need for, if you need x-rays, the type of x-rays and how frequently we need to take them. Okay, that's letting them know what you want to do, and they can say yes or no. I would like to discuss with you the assessment pertaining your oral health, right? I'm doing all of this fact finding. Can I relay this information that I've gotten to you? Nope, I don't want to know. Just do what you need to do. Okay, they're saying no. And then they're wincing in the chair. It hurts. It hurts. Gee, I wonder why. So that's when you are trying to give them information. There's a lot of, they didn't want to know anything of what's going on in their mouth, but you're having a lot of bleeding on this upper right area. I'm seeing that blah, blah, blah. Are the gum tissue sensitive? Well, perhaps if you, try angling the brush a little bit more towards your gum, you're getting the information to them, whether they want it or not. Okay, a lot of times they don't want it, but so you're asking permission. You are elicit provides elicit, okay? So I'm not going to ask questions on that, but that is part of the MI implementation. So I don't know what your boards are going to be asking, but motivational interviewing, guys, is big. It's big, right? So there's also a checklist for motivational interviewing that has that engage, focus, evoking, planning, and it can lead you through the techniques of that. Okay, but then we've got some core skills for motivational interviewing, and a lot of it is open-ended questions. Open-ended questions. It's not just a yes, no. We're asking more questions about it. Do you brush? Yes. Do you floss? No. How many times do you brush? Once. Is that per day? Yes. Versus, can you tell me a little bit about what your daily routine is? What do you do in the morning? What do you do in the evening? Is there anything that you do, throughout the day? Do you swish and spit? That type of thing. Those are open-ended questions. All right, and the book will give you samples of that on page 412. I think I've written down 412. Okay, then there's affirmations. Yay, you're doing so well. I'm glad that you're swishing and spitting, after each meal when you don't have the opportunity to brush. That's great. Well, we'd love for them to be brushing. Swishing and spitting is better than nothing. So we want to encourage, we want to support the patient, even when it's hard. All right, that helps build the trust. Okay, we're always trying to look at something good. Same way when they show you what they're doing with their toothbrush and you need to start from scratch. Well, okay, you're doing a nice job of scrubbing. Okay, you're scrubbing. The toothbrush is in your mouth and you're scrubbing. But can you see where all the purple is, right? This is where that scrubbing is not able to. So if it's okay, I'd like to show you how you can angle the toothbrush to be more effective with the time that you're spending. Oh, am I done? It's 10:50. Yeah, it stops at 11. Okay, well, here I am. Okay, then we've got reflective listening. What I hear you say is, okay, it's emphasizing what the patient's saying, okay, and then you're also summarizing. And that's pulling together all of that information. All right, so this is, it is time for us to say goodbye. And what I'm going to do is I'm going to let you all go, and I will finish a few pages that there are to go over, and then I'll post the recording. Okay, so don't feel you have to stay. It's a 2-hour lecture today.
Misty.
Yeah.
You said earlier that about Thursday street clothes with the white coat. Would you want us to bring our instruments and the whole gadget with us?
Nope.
Okay.
Nope, it's going to be orientation tomorrow, front desk, radiology. It's just going to be show and tell.
Thank you.
All right, and there's a schedule for the first couple of weeks before you start seeing your first patients in Canvas when you scroll down. Okay, so that's that. You all feel free to log off if you want. I'm just going to continue to chat, so we can have something posted, because I did not post this last year. So that's why I'm going through my notes here. All right, so the book had, you're welcome. The book has lots of examples of motivational interviewing, reflective listening, all of that other stuff that you're supposed to talk about and know about. But we want to sustain talk versus change talk. Okay, we want to continue the conversation and keep things open for the patients and make it comfortable for them to ask questions. Now, I don't quite understand this, that. Why do I have to do that? Well, can you see here in your mouth here? This is why I want you to do this in your mouth. Well, my husband's not doing that, or Johnny's not doing that, or whatever. It's like, that's right, but you've got this particular situation going on. So that is keeping the conversation going, just as, okay, discussion boards, right? You're not just saying one thing. Yay, good point. We want you to have a substantive response. I like how you brought up this and that. I didn't think of that. Or yes, I agree that patient blah, 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 blah is critical. And then, well, what about this? Or what about that? That keeps the conversation going. And it's reflective listening. Right, so there's a decision balance that a patient has to go through. Do they want it or do they not want it? And that's the point which the patient really needs to determine whether the benefits outweigh the risks of the current behavior. What is their current behavior getting them? Is it getting them anywhere? If I'm having a steak and cheese sub every day for lunch, and I'm trying to cut back on calories, so maybe I'll have French fries today instead of onion rings. Is that my balance for my change of behavior? No, it's not really. It's not getting me anywhere. You know, so you could be coming up if you were doing nutritional counseling and I was there for weight loss. Well, I don't want you to stop eating steak and cheese sandwiches or subs. Why don't you try eating half of it instead of the whole thing? Or just having it twice a week as a treat instead of every day. Okay, you're negotiating with your patient. Okay, that's the decision balance. You need to elicitate the patient's perception of the advantages, why it's better to do it this way versus that way. Not doing anything isn't going to change anything. Okay, and the advantages to making the change, the disadvantages to making the change. If you do nothing, nothing's going to change. If you do nothing, your periodontal disease may progress and you may end up losing your teeth. Okay, so that is the decision balance. Then there's that pro-con matrix, and that's also, it has a picture in the book as well. And I don't have a picture of that, but usually it's, you know, you've got a column for pro and you've got a column for con. If I do change, this will happen. If I don't change, this will happen. And those are for the list makers, okay? And you can see that the pros are going to outweigh the cons or whatever, okay? The list makers. And some people can do this and it's a good visual for them as well. How important is it to make that change? Well, let's make a list. Let's make a list. And that's that readiness ruler too. Be familiar with what these are. 1, not at all. 10, how likely are you? Okay, all these scales have different names to them, but these scales Okay, what is the patient's confidence level or motivation level? If they are putting a 1 or a 2 at this, at certain things, right, they're not ready for it. You can talk to them and talk to them and talk to them. It's not going to make any difference. All right. But if they're ready to change, okay, then you can talk to them somewhat. Okay, fine. That's great. I'll start giving you some basic information and you can let me know. All right. I'm not ready to quit smoking. I'm not ready. That's fine. Just know that I'm here for you for when and if that time comes, and I have some strategies that you might want to hear about. So let me know. Okay, you don't have to beat them over the head every time they come in. Oh, you're still smoking, aren't you, Mrs. Smith? Oh, okay. We have to address it because it does have an impact on their oral health, but we're not making them feel bad about it. We're not making them feel bad about it. I mean, I was able to avoid my doctor, my primary care doctor last year because of COVID, and I lied about my weight. And she believed me because all she saw was my shoulders up. And now I have to go see her and they need to take my blood pressure. And oh my God, I have the COVID 40. I'm not even 5'2". I put on 40 pounds during COVID. Guess how I handle stress? So I'm going to have to face the music. So this gives you some go-tos on a scale of 1 to 10, with 10 being very important. How important is it for you to brush twice a day? Well, my intention is there, but my willingness isn't. So I'd say it's a 5. Okay, or you said a 4. What makes you see it as that important? What can we do to get this on the other side of the scale to where it's more important? And sometimes it's discussing breath odor. Sometimes it's discussing the bugs that are accumulating in the mouth. Sometimes it's discussing the bacteria you have in your mouth is going to your partner's mouth. And the longer you partners are together, the more alike your bacteria is. You want healthy bacteria. Same way with your kids, with infants and babies. You know, the bacteria we have in our mouth is going into our child's mouth. We are setting up our child for the type of bacteria that they will have for the rest of their life. So we want you to have the healthiest type of bacteria possible. Let's get those strep mutans out of there. You don't want your baby being susceptible to all those caries. So, eliciting and recognizing change talk. What is their desire? Do they have the ability? Wish I could, but shoulda, woulda, coulda. I have some ideas that might be able to help. They don't have the time. They don't have the dexterity. Okay, well, I've got, we've got these special adaptive aids that might work, or a power toothbrush, an electric toothbrush might work better for you. Okay, instead of dental floss, let's try something else that might be more acceptable. Do you think that might work? And then you give them whatever it is, or suggest whatever it is, and follow up with them at that. But what are their reasons? Okay, what are their reasons for not wanting to make a change? And how can you try and help with that? And then there's the need. The need for the patient needs to be expressed when they recognize the urgency or begin to understand that they must make a change. Okay, must make a change. Now that's directly from the book. So what are those verbs? Must, have to, got to, should, ought to, need to. What needs to happen? That type of thing. What is their need? What is their need? What is their urgency? Right? Because they can still say, no, I don't want to. I'm not interested in this. But if you don't, this is what could happen. mobilizing change talk. We have commitment, action toward, and taking steps. So that's the acronym CAT, okay? Commitment, action, taking steps. CAT, mobilizing change talk. So commitment. We need to be able to gauge the patient's commitment to change in our conversation because we need to actively listen to them, right? Sometimes you're going to just brush over something for them. And it's going to be okay because they're not in a state where they want to hear all the talk on the disease process. Eventually, you've got to go over all of it. Okay, but today might not be the day. Today, you might just want to talk to them about brushing and the need for brushing. And let's get you brushing once a day. At least let's get that. And then we can start introducing other things. Sometimes you're mixing up the way that you're doing it and the steps that you're doing it, depending on what your patient's facing. Then you've got action toward. C is commitment, then action toward. All right, so that is, they're making baby steps. All right, I need to lose weight. I bought some meal replacements and TV frozen dinners that are calorie controlled to help me be accountable. And I have all of this salad stuff, fruits and vegetables in the refrigerator. And guess what? 2 weeks later, all those fruits and vegetables, they get thrown out because they went bad. Well, I took action towards, I wasted money, but I took action towards, all right? I bought the toothbrush, it's still in the box. I had that exercise bike. That's really a clothes stand. We've all done that. Please don't make me think I'm the only one, okay, in the group here. We've all done that. And then we're finally at the point where we're taking steps. And it's like, okay, I'm ready. I've taken my action. I've got all the foods and I'm going to start. I'm going to start. Those are taking steps. What is their commitment level? Okay, so we need to strengthen their commitment. If they're at a 6, let's get them to a 10. Okay, and that is your care plan, okay, or your plan. You need to have goals set with your patient. You're not setting the goals for your patient. You are having the patient set realistic goals. I'm not brushing my teeth every day. I'm not flossing. And you go over all of this stuff with your OHE book, and they said, then you've got to set up short-term goals. Well, my short-term goals is I'll be brushing 3 times a day and using dental floss once a day, and my plaque index, instead of being 100, will be 10% or less, because that's what you say that your goal is, 10% or less. And you're going, whoa, are those really realistic goals? Let's step back and with your lifestyle, what do you think is realistic? It might be just brushing once a day. And that's it. And that's okay. Right? So it's for us to help get the patient to have a clear plan. Because goals are goals. We won't always achieve them. But we want to have realistic goals and have options for them. And then you can brainstorm with the patient too. Well, okay, if you don't have time to floss, do you think you could do it in the shower? Do you think you could do it at a stoplight? I do a lot of my flossing in the car. I've got my little hand sanitizer and my floss and my little trash bag, and I'm busy at stoplights. Okay, or you can brush morning and night, and maybe flossing could be done after lunch before you start your afternoon. That's getting everything done that they need to do within the day. Or I always fall asleep on the couch. So I go straight to bed. Well, why don't you, when you're done with dinner, do your nighttime routine? Then you can. Yeah, class ends at 10:50. I'm going over, Michelle. You can leave. I'm just recording all of this. Long-winded today because we went over the we went over the syllabus. Oh, do I have 11:50 on the syllabus? Anyway, I'll check that. So this is going to be recorded and put on Canvas for you. So you've got your plan. We're giving the patient options. And we're brainstorming what will work with the patient. What are some of their obstacles? And then you're giving, well, what about this or what about that? Because we are their cheerleader. We are their cheerleader. Now, motivational interviewing with pediatric patients and caregivers, because you'll be seeing both of these, not only in clinic, but in private practice. But with pediatric patients, sometimes we're talking to their parents or their grandparents, or sometimes it's even a babysitter bringing the kids in private practice. But caregivers for the elderly, for the special needs patients, right? We're talking with the caregivers through all of this as well. But sometimes the caregiver is the one doing all of the oral hygiene for their clients or their loved ones. What is the ability for the patient? Sometimes it's giving, whether it's a child or a special needs patient, sometimes it's letting them do things first and then you just following up, kind of catching up what they couldn't. So we are our patients' coaches. We are their cheerleaders. We're not just asking yes and no questions. And as always, we are documenting what we discussed with the patients, what the patient stated, and what we did, what we gave them, even if it's pamphlets. The risk management people are telling us to, if we gave them a pamphlet on the Arrestin, we gave, or whatever, we gave them written and verbal post-op instructions. We gave them a pamphlet on toothbrushing technique. All right, that helps the documentation. All right, so that is what we had to go over, and I'm sorry that I was 20 minutes over time, but that is the chapter, guys. Any questions? I thank you. 24 of you stayed. What do you have this afternoon? Anything?
Just studying.
Oh, oh, okay. Just the studying. Good luck with everything. Just go through the 142 and 146 sites. I don't have Zoom for 146 set up either. 146 is a lot less intense. All right. It's so go through your sites just to get more familiar with them, and it will make things a lot easier for you. And look at some of the clinical things that we'll be going over on Thursday. Okay, that's it. Bye, guys.
Thank you.
You're welcome.
Thank you, Miss.